previous video, we covered allocative efficiency. In this video, Gwyn Bevan from the London School of Economics is going to discuss STAR, meaning socio-technical allocation of resources. STAR is one method for assessing the allocative efficiency of health systems or individual pathways and for identifying initiatives to improve it.
So my name is Gwyn Bevan from the London School of Economics, and what I'm going to do is to describe STAR, the socio-technical allocation of resources, which is the method we developed to help stakeholders in the NHS improve value of care pathways. This was a 10-year research project at LSE funded by the Health Foundation, but I hope you see it's like applied common sense. So what we've done is to develop ideas from health economics so that stakeholders can use them. They don't really understand, they're using economics to work out how to improve value in healthcare. And to do that, what we've developed are two visual models. The first visual model is what we call the value for money triangle. And a key element in looking at value in a care pathway, of course, to work out what value you get from an intervention. And to do that, we need to know what the benefit is per case in quality adjusted life years and the numbers who benefit. Now, if we multiply those two together, the average benefit per case and numbers who benefit, we'll get the total value of that component of the care pathway. We obviously also need to know what the costs are. So we need to work out what total costs, which comprise the fixed costs, typically staff costs do not vary with numbers of patients, with the elements like pharmaceuticals that do. And if we put those two together, we then work out the value for money triangle, which has got value across the vertical axis and across on the horizontal axis. And the slope of the triangle shows you the degree of value for money you get, which is in terms of the ratio of quality to costs. Now, the issue that we face in the NHS is that we typically know the numbers who are treated and benefit from care, estimate the numbers who benefit, but we do not regularly, routinely collect information on benefits per case. And the way we do that is you can look at the literature. There's information in NICE, often in Appendix E in page 233, or much of the time the things that you're looking at, you may find there isn't any information what that is. And what we do is to work with stakeholders in small groups to work out what that would be for a component in the care pathway. Now, the way qualities are worked out by stakeholders, and indeed in the literature, is to start off by working out what the quality of life is for a particular state of health. So this is something I worked through with people who had bipolar disorder. And what I asked them to do is to think about the two endpoints of quality of life, which are anchored at 0 being equivalent to dead and 100 being perfect quality of life, and think about where they would be in different states with bipolar disorder. And what they do is they find this quite a natural way of organising the states they've experienced and can work out pretty well where they stand on this scale. So they said that without treatment, sadly, people with untreated bipolar disorder do commit suicide. So they saw untreated bipolar disorder as being close to being dead with 0 quality of life. And if you're under a drug regime that controls the bipolar disorder, you move up from that, but not anywhere near perfect quality of life because your life is not under control. But they said, if you get expert psychological management that makes you feel like you're under control, then your life is close to perfect quality of life. And we had a similar outcome with discussion for people with back pain. What comes out to be really important in terms of these conditions is whether you feel your life's in control. So a key part of estimating the quality score is being able to work out what the scores would be for quality of life. And then what you need to do is to work out how that changes over time with and without treatment. So this is work we did with stakeholders in treatment with breast cancer. And this is for one component, which is for women with a poor prognosis and what would happen with and without treatment. So a green dotted line shows, a rough estimate as to what would happen to quality of life without treatment. This is obviously very poor prognosis. They'd be expected to live about a year and a half, and the quality of life would fall off dramatically. With treatment, radiotherapy and chemotherapy, there are times when quality of life falls because the treatment is so painful and distressing, but then they recover and they have a longer life expectancy and gains in quality of life. And what the QALY is the difference between the area under these two trajectories. In this case, this comes out to be approximately 1 QALY. And what we found is that this is an invaluable way of engaging stakeholders, and the discussion gives you information as to what people feel about different interventions and the scale of benefit they get and what matters to them. It's enormously informative, not just in giving numbers, but in giving meaning to the numbers. The second visual model then is to look across the different components of the care pathway and organise them in terms of the slopes of the triangles, because the slope tells you which ones are giving good and poor value for money. And the great advantage of this diagram is it's very easy to see where you're getting good value for money, as in the blue triangle. You're not spending very much money and getting vast amount of benefit. In red and green ones, you're spending lots of money and little benefit. Now, the NHS is obviously desperately short of money at the moment, but in fact its scarcest resort is the management effort and capacity to make strategic changes. So one of the things that drove us in developing this approach is enabling stakeholders to see where putting effort into moving resources around would be of greatest benefit. And what you want to do for that is to focus on the interventions that are poor value for money but consume lots of resources. So in this case, although the green triangle is worst in terms of efficiency, it's not using much resources. It's the red triangle you want to go for. And if you can release resources from that and put it into the blue triangle, you can transform value in a care pathway. This shows what happened when we did this. This was the North East Commissioning Support Unit with stakeholders in Hartlepool and Stockton-on-Tees for components of the care pathway of chronic obstructive pulmonary disease, COPD. And this conveys so much information as to how they're spending resources on the treatment of COPD. And of course, the most striking point here is that most of the resources, about 2/3 on triangles 4, 5, 6, and 7, are going on intervention that produce very little benefits in terms of quality of life. And the second thing to note is the triangles with making the biggest impact are 1, which is smoking cessation, and 3, which is a flu jab, are generic interventions that are preventive and are not specific to COPD. The stakeholders were astonished to see that one of the things that they do to prevent COPD getting worse, which is pulmonary rehabilitation, which is the green triangle, number 4, has such a minimal impact on treatment of COPD because few people take it up and few people stay the course. I was involved in discussions with the specialist nurse who was responsible for inhalers, and they prescribed very expensive steroidal inhalers, but she knows mostly they use it with poor technique. And a young physician recently appointed as a consultant who saw acute admissions as just being a place where people went with COPD because there was nowhere else to go. So the great thing about these diagrams is they give you this overview as to where you're getting good value for money, where you're getting poor value for money, and how you ought to move resources around. So this is what STAR does, and I hope you'll see its applied common sense.